Today we're going to talk about spirometry. Spirometry is a breathing test that is used to measure expiration after fully inhaling. It can be used to diagnose certain lung diseases. It also can be used to progress the disease and see if it's getting any better due to treatment or if it's getting any worse. And finally, it can be used to quantify the severity of the disease.
The results of this spirometry test give three important values that are used to determine if a lung disease is present. These include the forced vital capacity, or FVC, which is the total volume of air you can forcefully blow out after a maximal inspiration. The forced expiratory volume at 1 second, or FEV1, is the volume of air that you can blow out in the first second of a maximal expiration. The expiratory flow rate, or FEV1-FVC ratio, compares the volume of air expelled in the first second to the total volume expelled. We're going to perform a basic spirometry test for you just to give an example of some normal expected values that you would see. All right, ready? Inhale, inhale, deeper, 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 and exhale. Push, 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 keep going, push, push, push. Keep going, keep going, keep going. Good job. So these are some normal values that we would expect. First, we have our FVC that we talked about earlier, and we're getting about 6.48 liters, which is the maximal amount that they could expel. Then we're talking about our FEV1, which is how much air they were able to expel in 1 second, and that was about 5.69 liters. Then coming over here, we have our FEV1-FVC ratio, which is a comparison of how much air could be exhaled in 1 second compared to their total air exhaled, and that was about a 0.88 ratio.
Now that we know some normal values and what they should be, now we're going to take a look at some lung diseases that can affect these results and cause abnormal values in spirometry testing. We're going to talk about two lung diseases in particular. We're going to talk obstructive lung disease and restrictive lung disease. First lung disease, we're going to talk about restrictive lung disease. Restrictive lung disease is a chronic disorder that decreases the ability of the lungs to expand fully. They're able to take in less oxygen with each breath, which makes it harder for them to take in enough oxygen to meet the body's supply, which can cause problems. Some examples of restrictive pulmonary disease include pulmonary fibrosis and sarcoidosis. With these diseases, they cause inflammation and scarring of the lungs, and this inflammation actually causes the lungs to stiffen. So instead of being flexible like lungs usually are, they're a little harder, and it's harder for them to expand fully and take in enough oxygen. Another example is neuromuscular diseases, and when these diseases affect the musculature of the chest wall, this decreases the ability of the chest wall to expand fully, so the lungs cannot take in enough oxygen. Now, how these diseases affect the spirometry results is the forced vital capacity in patients with restrictive lung disease is decreased. The reason for this is because the lungs are stiffer and they cannot expand fully, less oxygen is able to be taken in. Therefore, less oxygen is able to be blown out as well. So therefore, the forced vital capacity will be decreased. Now, based on how low the forced vital capacity is will determine how severe the lung disease is. So just to give you some numbers, mild restriction is defined as 65 to 80% of the predicted forced vital capacity. The predicted forced vital capacity is just based on age, sex, height, weight, and ethnicity. So say their predicted will be like 4.6 liters. A person with restrictive lung disease might only be able to expire 65% of that, and then they would be categorized as having mild restriction. Moderate restriction is defined as having 50 to 65% of that predicted value, and then severe restriction is defined as having less than 50% of that forced vital capacity. Also, forced expiratory volume at 1 second is also decreased, and that's decreased for the same reason the forced vital capacity is decreased. Because less oxygen is in the lungs from the start, less can be blown out. So forced vital FEV1 is also decreased. Finally, the FEV1-FVC ratio is usually normal in people with restrictive lung disease. The reason for that is because the FEV1 and the FVC are decreased proportionally. Therefore, since they're both decreased, the ratio stays about the same.
Now we're going to try and imitate the effect of restrictive pulmonary disease by wrapping a tight strap around a participant's chest. The strap will actually restrict the ability of the lungs to fully expand, just like the inflammation would restrict the expansion of the lungs in patients with restrictive diseases. Okay, ready? And inhale, inhale, deeper, keep going, and exhale, push, 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 harder, harder, keep going, keep going, keep going. Good job.
As with restricted disease, the forced vital capacity is decreased compared to the normal values we measured at the beginning. Also, the FEV1 is decreased as expected, and then the FEV1 FVC ratio is about the same. It actually is a little increased. So these results are what we expect. The FVC and FEV1 are decreased because less oxygen is able to be taken up into the lungs, so less is going to be able to be expired. And the FEV1 FVC ratio is about the same, which is what we expect.
The last lung disease that can be diagnosed using spirometry that we're going to discuss today is obstructive lung diseases. Obstructive lung disease is a chronic disorder that alters the structure and function of the lungs so air can no longer pass through as easily. This increased airway resistance is due to excessive mucus production and decreased lung elasticity, which in effect causes a narrowing of the airway passages, preventing the patient from being able to exhale normally. This leads to excess air being left in the lungs, decreasing the amount of oxygen and carbon dioxide exchange. Obstructive pulmonary diseases include chronic bronchitis. This is when irritants, usually cigarette smoke, pollutants, or allergens, cause a high mucus production, and this swells the bronchial linings of the respiratory tract, which increases the airway resistance. Another obstructive pulmonary disease includes emphysema, and this is the decreased elasticity of the bronchioles as well as the alveoli within the lungs. Now, in respect to forced vital capacity in patients with obstructive lung disease, it should be slightly decreased. This is due to the body's inability to push out most of the air in the lungs because of the loss of elasticity in the bronchial linings. When we look at the FEV1, or forced expiratory volume, at 1 second, the amount of air expired in 1 second will be much less than the normal value of about 80% of the forced vital capacity. We would expect values around 60% or lower of the FEV1 due to the narrowing of the airways as well as the lessened elasticity of the respiratory system. And finally, when we examine the expiratory flow rate, it will be less than the normal 80% because the volume of air expired in 1 second should be dramatically less than normal, which greatly reduces the ratio to 70% or less. Now, we're going to try to imitate the effects of an obstructive lung disease by exhaling through a straw, which will increase airway resistance just as excess mucus production and lessened lung elasticity does in patients with obstructive pulmonary diseases. And inhale, inhale, deeper, deeper, and exhale, push, 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 keep going, come on, all the way, keep going, keep going. Good job. Now, as you can see with obstructive disease compared to our normal values, our forced vital capacity only decreased slightly because they can get all of the air out eventually. It just takes much longer. It's much harder to. Our FEV1 is decreased. And then when we look at our FEV1 FVC ratio, it is much lower, as expected.